Today I want to talk about traumatic brain injury and cannabidiol. The cannabidiol has some extraordinary properties, and I want to discuss about traumatic brain injury and the entire spectrum of brain injury that we can see with it. Now, I'm Colonel Blair, and I'm retired U.S. Army as well as a physician. I spent 30 years as a family practitioner. I've also done quite a bit of disease management for a number of different problems, but cannabidiol is probably the most extraordinary substance and the most extraordinary treatment that I have ever seen. Let's talk about the agenda that I'm going to talk about today. First off, we'll go through the burden of disease that we can expect with the syndromes and the spectrum of traumatic brain disease and injury. We'll talk about some of the conventional causes and treatments, and we'll talk about the endocannabinoid deficiency that is really at the heart of this condition as well as many other conditions. I'll give you some of the evidence for cannabidiol and its particular benefits, and we'll talk about serving sizes and managements in TBI, and I'll give you a list of references, and we'll have a question and answer period at the end. So if we're talking about the spectrum of traumatic brain injury, this is what I envision it encompassing. There are possibly more items that could be included on this, but for the most part, we're talking about the general category of traumatic brain injury, and that in terms includes a moderate trauma, so not enough to cause a major traumatic injury to the brain, but enough to cause significant trauma. Blast injuries, concussion, and a phenomena that we see is sort of subclinical traumatic brain injury, which is chronic traumatic encephalitis. So we'll be focusing mostly on the moderate trauma areas for traumatic brain injury, but it really does encompass all of these areas, and the therapeutic approaches that I have are going to be applicable in all of them. We're talking about the burden of disease for traumatic brain injury. On the surface, we're talking about 5 million Americans who are face this particular problem on a day in and day out basis. In addition, we know that it costs around $60 billion on a yearly basis to handle this particular disease entity. And every episode of traumatic brain injury costs at least $150,000. Now, traumatic brain injury is the leading cause of death for ages 15 to 44. So it's a young people's phenomenon in terms of the brain injury causing death, at least the leading cause of death for this particular age group. If we're looking at the mechanisms of disease with regard to TBI, we can think of it in terms of the focal damage. And so this is the focal damage is where you have either a injury to skull fracture, or you have disruption and bleeding within the brain, or you have major damage from a projectile into the brain. That's not what my focus is going to be on today. I'm going to be looking at the diffuse causes, and these are much more subtle and causing many more problems and lifetime problems for people. When we're looking at the diffuse causes, we're talking about things that occur all over the brain. It tends to be focused in other areas or in particular regions in the brain. But I want you to think of this in terms of the microvasculature, not the major blood vessels, but the capillaries and the small arterioles that are there. Think in terms of also ischemic, but not the ischemic level that we see with a stroke. We're talking about something on the order of a microstroke, a microvasculature, and ischemia down to a cellular level or a very narrow region. And ultimately, we're going to be focused on axonal disease, because this is where the major part of the manifestations that we see on a day in and day out basis for traumatic brain injury occurring at the axon of the nerve cell. This is a very sensitive area, and it's particularly prone towards injury, especially from the concussive nature of these types of injuries, as well as repeated damage that occurs. And this is sort of why that occurs. Of course, we understand that the axon can be quite extended, that from the cell body to the distant points of the axon, it can be almost a meter in length. So you've got a huge distance, and it's particularly susceptible because the axons run in tracks frequently, and they have microtubules and microfilaments that are aligned just perfectly in order to provide transport, nutrition, and the information as it passes from the cell body to the distal points of the cell. So these particular structures are particularly susceptible to traumatic type of injury, whether it's a blast or a shock wave, or it's a matter of a jerking motion that occurs, or concussion, or major trauma that does occur from a acceleration and deceleration type of injury. So I want you to see that this is the particular focus area, and why some of the damage and some of the injury that we see is so subtle. It's not like we see bleeding, we see skull fractures, we see very subtle changes that are occurring in the axon that represent the disease for a lot of the brain dysfunction that is associated with traumatic brain injury. Within that axon and the injuries that occur as a result of trauma, we're seeing disruptions in the microtubules. We're seeing permeability changes in the cell and in the axon itself, so the changes in fluxes as a result of this injury. The transport mechanisms of getting nutrients and precursor molecules to the distal ends of the axon and back to the cell body can be disrupted, as well as disruption of the mitochondria that are in the cell body so that their energy function is not performing properly. In addition, there are accumulations of organelles and proteins that are misfolded, leaving the formation of abnormal proteins like tau proteins that are found inside the axon as well as inside the cell body. In addition, you have excessive oxidative stress that's going on. We all know that oxidative stress is a high-risk entity leading to the death of some cells and the potentiation of other damage going on with the neurons themselves. There are a couple more very important points with regard to traumatic brain injury. And what we're seeing also is, we talked a little bit about mentioning about the microvasculature, but we're also seeing exciticity that occurs, where the stimulation of the brain is it produces a very high level of neurotransmitters, and glutamate in particular, that leads to an excitability of the brain cells to the point of being toxic and causing a great deal of potential damage. In addition, we're seeing changes in the microglial cells, and you'll all understand that microglial cells are those collections of cells that are working within the brain that act as support and are the macrophages and substance in the cells that produce the protection and also produce the inflammation that goes on with the brain. What's happening here is with this type of injury that occurs in the brain, with traumatic injuries of all types, we're seeing an activation of the glial cells, and whether that's the astrocytes producing a glycosis, where you have a generation of too many astrocytes that leads to scar formation or disruption in the tracts of the nerves, or whether it's the microglia that are providing inflammatory stimulation to the rest of the brain and stimulating inflammation in all areas. These are very important areas that are part of these pathways of disease that lead to not only the acute disruption and the injury that's inflicted, but also to some of the long-term type of problems. Now, the conventional treatment for these types of problems is really quite minimal. There are no good drugs that have been shown to be truly effective. Currently, the treatment program for traumatic brain injury is brain rest. Sometimes it's coma that's induced. Sometimes it's if there's building up of pressure, there are release valves, and there's a monitoring of pressure to make sure that there is not too much or herniation of the brain into the large cavities, so that you have a brain rest phenomenon that's going on. Even in the case of concussions, we're really talking about putting people at rest, avoiding particular exercise and activities. There's no real active treatment that is going on with these people. In addition, there may be steroids that'll be used, and there's really supportive care that is advised for patients. Minimal type of interventions, and there are no current drugs that seem to be effective for these types of problems. But if we look down close and we get into some of the detail, the information that is coming out shows a major endocannabinoid dysfunction that's going on within the brain. And sometimes that is high levels of anandamide and low number of receptors, cannabinoid receptors. It depends on the area of the brain, and it depends on the situation that occurs. We're seeing fluxes in both. Now, a peculiar phenomenon is that men and women have different responses to trauma. There seems to be evidence showing that women have a better chance for survival with major trauma than men do, and that may be to the different balances of the endocannabinoids that are circulating. The whole purpose the body has to do is restore the endocannabinoid system, get it back to functioning properly. And the endocannabinoid system is so important in this area, and so many aspects of traumatic brain injury that have to be addressed. And the endocannabinoid system is the mediator for almost all of these programs. If we're looking at cannabidiol and the effects that it has on the brain, especially in traumatic brain injury, it's really quite phenomenal in terms of what cannabidiol has been shown to do, especially in animal and cell culture models. Consistently, cannabidiol is neuroprotective. It also protects against within the neuroplasticity. And neuroplasticity is the term that really refers to the adjustments of the neurotransmitters at the synapses, regulating the amount of neurotransmitter that's there, as well as the formation of new axons and new connections with brain cells to other parts of the body. It's modulating the cytokines so that you're reducing the inflammatory substance that is circulating, as well as modulating the neurotransmitters, particularly glutamate, reducing the outflow of this inflammatory and excitotoxin that can occur, and is self-destructive in itself. In addition, we're seeing cannabidiol regulating the immune cells in the form of the microglials and the astroglial cells that provide the support for the nerve cells and help preserve their function in not just short term. Certainly there is an acute situation where cannabidiol is very effective and preserve neurologic functions. In fact, some studies show as much as a 50% protection for cells that normally would die off without the protection, but cannabidiol has been able to protect those cells from destruction in the most severe of traumatic brain types of injuries. Now, the blood-brain barrier also plays a role in traumatic brain injury, and cannabidiol seems to restore this blood-brain barrier continuity as well as cell permeability. So you're getting the protections that need to be there. The body's supposed to do these things, but oftentimes with the secondary injuries that occur as a result of traumatic brain injury, then you have this inflammatory situation, and we get an exacerbation of the problem as a result of these immunologic breakdowns and inflammatory situations that occur within the brain and other tissues. Furthermore, we're seeing that cannabidiol modulates the mitochondrial energy itself, restoring the mitochondria back to function, because that's another area, another target area of damage that occurs in traumatic brain injury. And the cannabidiol is rebalancing the energy formation and production that's going on within the mitochondria itself. Now, there are actually receptors that are on the mitochondria that respond to cannabidiol when it gets to there. In addition, even the cell nucleus is responding to cannabidiol, where we've got signaling molecules and the PPAR receptors type gamma that are located on the nucleus, shifting the enzymes and the substances that the nucleus is producing to reduce the inflammatory reactions and to restore good cell function. Furthermore, we've got the effects of cannabidiol as a major oxidative stress reduction program, and acting as an anti-inflammatory across the brain barrier as well as throughout the brain. So a number of very sophisticated and comprehensive approaches that cannabidiol is offering. So rather than just a single magic bullet, we're seeing a whole plethora of areas where cannabidiol is making a huge impact on the brain function and protecting it from the destruction that generally follows a traumatic brain injury. Time is very important in so many things. If it's a heart attack or it's a major trauma, and for the brain, that's no different. And so within the first 3 hours, we're starting to see the severe inflammatory reactions take place, and all of the things that we talked about in terms of the pathology occurring. So if we can get to people with traumatic brain injuries with cannabidiol within 3 hours, we can probably preserve more and more of those functions and minimize the amount of secondary injury that this inflammatory cascade occurs that causes within the brain. So 30 milligrams, I think twice daily, but immediately and as soon as possible after a traumatic brain injury. And that is something as simple as a concussion or a blast, any of these problems. And it's very likely this will prevent so many of the problems, including PTSD, which is a part of the problems that commonly occur behaviorally as a result of major trauma. In picking a particular product, probably the best form is the tincture. And the tincture is easy to use. It could be applied to the skin as well as taken orally if there's some alteration in consciousness. Adjust the dose early and boldly to control the symptoms. In most cases, we're talking about people who are awake and alert, and it's a matter of adjusting to what they're responsive to and control some of the symptoms, whether that's headache or it's muscle pain or damage to a joint or some other types of injuries. The target dose, as I see it, is about 30 to 60 milligrams per day. I think that's the best blend. We see that as having a superb effect as an anti-inflammatory and an immune modulator, even in diseases, autoimmune diseases like rheumatoid arthritis, psoriatic arthritis, or lupus. So I think this is an excellent target area, but it should be adjusted to the particular needs of the individual. How long? I think 4 weeks. The evidence in the studies is typically about 2 weeks duration, but 4 weeks is probably a good margin of error, and then a maintenance dose after that. A maintenance dose probably about 1/4 of the dosage at 60 milligrams. So we're really talking about 15 milligrams a day as a maintenance. And I think that this is important because a lot of these traumatic brain injuries, yes, you have an acute injury, but many of these problems and even axon degeneration occurs for years after the particular inciting incident. So it's really valuable to keep this protection going so that you maintain the nerve cell health and the brain function and optimize performance. And for those athletes that may be involved with something in the order of a traumatic injury, then I think you have to consider using something prophylactically and preventing them from sustaining those types of injuries in the future, and at least preventing some of the complications that can occur. Well, who should be using cannabidiol? A lot of times we talk about patients, people with symptoms that are unresponsive, people who are at very high risk or at high levels of potential problems, impaired organ function, maximum support and protection is needed in these particular cases. These are all great and ideals, and these are the things we want to use cannabidiol for most people. I think in the case of traumatic brain injury, if we can get people to use this in those types of injuries, I think we're going to save a lot of lives, we're going to save a lot of money, and we're going to save a lot of complications, life complications. Now, cannabidiol is also effective for epilepsy and other types of brain injuries, as well as Crohn's disease, Alzheimer's, and chronic narcotic use for addictions. We talked about the huge burden of traumatic brain injury as it causes problems within our population. The endocannabinoid deficiency is at the core of much of this, or at least the controlling point for a lot of the manifestations of traumatic brain injury. We talked about cannabidiol addressing so many of the pathways of brain disorders and all the things that cannabidiol could do to preserve life and preserve brain cells. Cannabidiol is supported in preclinical studies widely and in practice as well in terms of restoring people. That's one of the things that I didn't mention earlier, and I want to emphasize is that many times people who have losses in brain function can actually be restored to at least partial function and bring them back from cognitive losses that they've had, memory dysfunction. A lot of these things can actually reform and they can reestablish those connections. Probably has to do with the neuroplasticity as well as the protection that's engaged. There's no significant adverse effects to cannabidiol. There's no toxicity, and there's rare drug interactions that can happen with it. Dosing is really quite modest, with the results being very quick. You don't have to wait a long time to see the results for cannabidiol. They should happen within minutes or within hours, and you should see the responses very quickly within the first few days. So that's the end of my formal talk. I have taken the references that I've done for this research in the literature, and I've put them into the folder that's listed here, the references for the brain folder. That's accessible by you. You're welcome to go in there. If you want to know a review, you want to see a review of cannabidiol and the PDFs that are available, I've got those listed as well. And at this point, I want to thank you all for coming to this presentation. And I hope to continue to provide exciting topics for your review, as well as some of the information that I discover as I review the literature and I review the evidence and the experience within my clinical practice of seeing the results of cannabidiol on so many patients.